Newborn Resuscitation, a comprehensive guide. Newborn resuscitation is a critical skill that healthcare professionals use to provide life-saving support to newborns who are unable to breathe or maintain a stable heart rate after birth. Immediate intervention is essential to prevent brain damage, organ failure, or death, especially in cases of compromised respiratory function or cardiovascular instability. The key steps in newborn resuscitation are: 1. Initial assessment and preparation. Immediately after birth, assess the newborn's condition using the Apgar score, which evaluates appearance, pulse, grimace, activity, and respiration at 1 and 5 minutes. Ensure the environment is warm and the baby is positioned appropriately, head in a neutral position. 2. Airway management. Clear the airway if necessary by gently suctioning the mouth and nose using a bulb syringe or suction device. Ensure the baby's airway is open and unobstructed. 3. Breathing support. If the newborn is not breathing or has a weak respiratory effort, begin positive pressure ventilation, PPV, with a bag mask or neonatal resuscitation device, NRD. Ensure adequate chest rise to confirm effective ventilation. 4. Chest compressions. If the heart rate remains below 60 beats per minute despite effective ventilation, initiate chest compressions. Perform them at a ratio of 3 compressions to 1 ventilation. The compressions should be quick and effective, using 2 fingers or 2 thumbs, for infants 60 seconds old. 5. Medications. If the heart rate remains below 60 BPM despite chest compressions and ventilation, administer epinephrine intravenously or via the umbilical vein. 6. Monitoring and ongoing support. Continue to monitor the newborn's heart rate, oxygenation, and temperature. Provide supplemental oxygen if needed, and maintain warmth to prevent hypothermia. Key considerations. Timing is critical. Resuscitation should begin immediately when the newborn shows signs of distress. Teamwork. Proper coordination between the attending healthcare team is essential for effective resuscitation. Neonatal Resuscitation Program, NRP, professionals should be trained in the NRP guidelines to ensure evidence-based, effective care. In summary, newborn resuscitation is a time-sensitive process aimed at stabilizing the newborn and ensuring adequate oxygenation and circulation. Early intervention and proper techniques can drastically improve outcomes, saving the lives of infants at risk birth asphyxia or other critical conditions.